Hi, I'm Jasmine Brooks. I'm in Term 2, Adult Health 1. I'll be demonstrating how to administer IV medication via piggyback method. Okay, so I'm going to get started. So first I'm going to check my chart, and I'm looking at the fact that my doctor just ordered Rosefrin. He ordered it for IV 2 milliliters, IV over 30 minutes, and 50 ml of solution. So I'm going to check for the patient's allergies, and she has no allergies, which that is good because contradictions to Rosefrin is if you're allergic to Ceftin, penicillin, if you ever had an anaphylactic reaction to penicillin, as well as cephalosporins. Also, it is contradicted in pregnancy, and she's not of childbearing age and breastfeeding. And I will check her labs because hepatic and renal disease are contradictions of Rosefrin as well. And her BUN creatinine, as well as her ALT and AST, are within normal limits. The purpose of Rosefrin is to treat and fight the bacteria, and the action is it binds to the bacterial cell wall, causing cell death. Side effects are GI upset, fevers, and it's administered IV over 30 minutes, which we're going to do. And infusion time, I have calculated, is going to be 17 drops per minute. And I want to let you see my doctor's orders as well. So my doctor ordered Rosefrin 1 gram IV daily as directed. And what we have on hand is Rosefrin 500 milligrams per ml. Therefore, through my calculations, I have calculated that we will be administering 2 milliliters. And the recommended dose for Rosefrin is 1 to 2 grams daily. So our doctor's order is within the safe dose range. Okay, so now I'm at my nursing station. I'm going to clean my hands, and I want to prep everything that I need. So I have my Rosefrin here. I have my 50 ml of sodium chloride, which I will be adding on the Rosefrin to. I have my piggyback set, my secondary tubing, and what I'll be drawing up with. So first, I'm going to check the integrity. I see that the expiration date is 6/2016, so it is not expired. Also, the packages has good integrity, doesn't look tampered with, so it is free to use, as well as my sodium chloride. The expiration date is in good standing. Alright, so with my clean hands, I'm going to clean off my Rosefrin, and I will be administering 2 ml, so I'm just going to draw back 2 ml of air. Okay. Insert into my Rosefrin, and I'm going to pull back, of course, 2 ml of Rosefrin. Okay. So now I'm going to use the scoop method. If it stops running away from me, okay. Alright, so we have my 2 ml of Rosefrin, and I'm going to add it to my 50 ml of sodium chloride. So I'm going to clean off my port, using an alcohol wipe, and inject my Rosefrin into my sodium chloride. Being careful not to puncture myself. Okay, using the scoop method again. Okay, I will dispose of this in a sharps container. Okay, so I'm just going to mix my bag. Now that it is mixed, I am going to actually add my medication label. My medication label is going to contain how much I added. So I added Rosefrin, 2 milliliters, and it was added by me, Jasmine Brooks. I'm going to have the date, the time, the expiration date, the room number, as well as my patient's identifier, and the start time. And the start time will be added when you get inside the room and actually start the IV, just in case something happens in between that time. Okay, so next I will be priming my tubing. Okay, so we're going to make sure first that all my clamps are closed, and it is. So I'm going to prime my tubing. Alright, so all my clamps are closed. going to slowly open to continue to prime my tubing. Alright. Letting out any air bubbles. Not too much because you got medication. Okay. So now that my tubing is primed, I'm going to go inside my patient's room. Okay.
Come on in.
Okay. My name is Jasmine. I'm going to be your nurse today. Can you identify your name and your date of birth for me?
Jasmine Messick, November 22nd, 1987.
Okay, Miss Messick. And I'm going to be giving you your... Oh, do you have any allergies?
No.
No. Okay. So I'm going to be giving you your IV antibiotics today. Just going to hang it up here. So I'm just going to check. She has her normal saline running. I'm going to wash my hands before touching the patient. And she has her normal saline running. I'm just checking the integrity of the IV site. So no signs of infiltration, no swelling, no tenderness to the site, and no redness. And it looks like it's running in good, so no contradiction to why we can't use this IV site. Okay. So have you ever had a reaction to antibiotics before?
No.
Okay, great. So that is sometimes common, and she does not have any known allergies, so I did assess for that. So now I'm going to go ahead and clamp my IV line. I said I had my gloves on, but I'll go ahead and put them on in reality. Alright, so I'm going to go ahead and clamp my IV line. That way I can hang my mini bag. Alright. So now that it is clamped, I will take and I will lower my primary line. Secondary line here. I'm going to use this port, so therefore I need to clean the port before. I have my vial in the room with me, so I have my mark to be sure that we have the right drug and the right patient at the right dose and the route group. So we have everything we need. So now that this is, make sure this is also clamped before we begin, and it is. Alright, so I'm going to connect my secondary. And now, like I told you earlier, I showed you the drops per minute, but now I'm actually going to watch the drops per minute so I can calculate my drops per minute. So I'll then now open up my line as well as
thank you.
Open up here. So I can start calculating the drops per minute. I'll squeeze my X's and I start calculating my drops per minute. And now I'm now calculating 17 drops per minute. So now that we have set it at 17 drops per minute, I will then continue to assess. I would stay with the patient for at least the first few minutes of infusion time, just to watch for any kind of allergic reactions to the IV antibiotics. After then, I will periodically come back in and check and see how it is doing. I will take off my gloves and wash my hands. And just continue to monitor. So after 30 minutes, I will come re-enter the room. So, coming back in.
Come on in.
Okay. Can you identify? I'm Jasmine again. Can you identify the name and your date of birth?
Jasmine Messick, November 22nd, 1987.
Okay. And she doesn't have any allergies. I don't think she has any allergies within the last 30 minutes that I've been here. So, doesn't have any allergies. Okay. So then now that I'm here, I'm going to, now that the rosaffron has done an infusion, it's been 30 minutes, go ahead and wash my hands and disconnect my rosaffron. So at this point, I will again, after I wash my hands, put on my gloves. assess my IV site, and it still looks good. No sign of infiltration. Do you feel any tenderness, Miss Messick?
No.
No pain or tenderness at the site, so that's good. I'm gonna clamp. Go ahead and clamp my secondary. Alright. So now that my secondary is unclamped, I will put an alligator clamp on this per facility protocol, whatever kind of disinfectant agent they have to keep this clean until the next time of administration of medication. And hang it. Okay. So then I will go ahead and restart my primary line and unclamp, and then continue to allow it to run. So now that I've done that, her IV is now running back to her primary. The infusion is over for the Rocephin. I will then I'm going to document the condition of the IV site. I'm going to document the time, the route, which was IV, the dosage, which is the 2 mLs, as well as I'm going to document the drug, which of course was Rocephin. And I'm also going to document any client teaching, the time, any client teaching that I gave, as well as the reaction to the antibiotics, but she didn't have any reaction, and of course my initials and the date and the time. Thank you.